You've probably experienced this. Sitting in an exam room, pouring your heart out, and your doctor is staring at a glowing rectangle, furiously typing. They aren't ignoring you. They are capturing the details of your visit so your medical history is legible and standardized for the next doctor, specialist, or hospital that needs it. Providers rely on the SOAP note, organizing data into subjective, objective, assessment, and plan. Subjective records symptoms. Objective handles vitals and exams. Assessment logs the diagnosis, and plan outlines treatment and follow-up. This high level of standardization allows different health systems to share records seamlessly. It also creates a structured data set that analytics tools use to spot patient safety risks or track the progress of a chronic illness over several years. But there is a catch. The process required to generate these records has turned highly trained physicians into data entry clerks, wedging a computer screen right between doctor and patient. To fix this, hospitals need a way to build these dense, structured notes without the doctor ever touching a keyboard. That is exactly what Ambient AI is designed to do. Instead of dictating specific commands, the doctor simply talks to the patient. Ambient AI relies on advanced microphones, often just from a smartphone or badge, to quietly capture the natural conversation in the background. It is built for the messy reality of human speech. The system uses sophisticated speech recognition to instantly process heavy accents, parse complex medical terminology, and ignore those normal, everyday tangents that happen during a checkup. The technology provides a finished draft of the medical narrative in real time, allowing a physician to finish an encounter with the documentation already largely complete. Recording the words is only the first step. To actually build a clinical note, the AI has to understand the context behind them. Watch this filter. It separates the chief complaint from medical history. It places physical findings in one bucket and subjective symptoms in another. Finally, it differentiates medications from new treatments, cascading all sorted data into the required SOAP structure. It even quietly handles the tedious administrative formatting and generates the necessary medical coding suggestions along the way. The AI acts as an invisible scribe. It takes on the heavy administrative lifting, ensuring the clinical data is perfectly prepped before the doctor even reaches for a mouse. As powerful as this sorting capability is, smart hospitals must draw a strict line between machine administration and human clinical intelligence. Ambient AI is strictly a documentation assistant. It records what is observed and decided, but it is explicitly prohibited from making clinical judgments or suggesting diagnoses. Notice the hard boundary here. The AI remains on the documentation side. It does not replace clinical thinking or create patient assessments. Because the machine cannot practice medicine, every drafted note must cross that boundary for the physician's final review and approval. These systems are also tightly restricted by patient privacy laws. They are fully HIPAA compliant, they are deeply encrypted, and audio is permanently deleted the moment the text is processed. When hospitals struggle with this technology, it is usually because they allow their expectations to drift. The real risk lies in mistaking administrative relief for clinical intelligence. The machine is a tool, not a doctor. When those boundaries are respected, something remarkable happens. By trusting the AI with the clerical work, the immense cognitive load of constant note-taking is lifted off the physician's shoulders. Without the burden of typing, the screen barrier vanishes. The doctor's focus returns to where it belongs, listening, examining, and connecting with the patient. Removing these administrative barriers allows the human relationship at the center of medicine to become the focus of the encounter once again.